It's good working with natives. I've worked with natives all my life. So I'm native, so.
Can you show me your teeth? Show me your teeth.
I look at the Well Child Visit as an opportunity to talk about vaccines and the importance of them. But as caregivers, have you had your COVID vaccine? Are you going to get it? What's your thoughts on that?
On the COVID shot?
Yeah.
It's not for me.
Okay. Have you heard of any bad experiences?
I hear about it on the news.
Okay.
And I'm not the only one. Both of my older boys, they're not getting them.
They're not going to get
He's not going to get them for his kids, and his wife's not getting it. No.
Okay. Do you think it's not safe, or?
No, I'm just not getting it.
It's not going to do it?
Yep, it's not going to do it.
Okay, can you have them sit perfectly fine?
I'm Iris De La Rosa. I have worked for Tri-Valley for about 2 years, and I'm a program nurse. We do provide education about the COVID immunization and how important it is to get it. And if that's something they're interested in, we can get them connected, because some don't have internet, some don't have a computer, some don't have those resources to do it.
I'm definitely not doing the COVID shot. I'm not giving it to my kids, especially Heavenly, because of her immune system.
Is there certain concerns you just don't, you have?
Because I say we've survived Ebola, SARS, anthrax. These have been short-lived viruses. And then here comes this one that is just kicking doors down and just taking lives left and right. So to be precautious, yes. I had my mask on, but a 2-year-old kidnapped it. So tendencies to proceed with caution.
Yeah.
But as far as the vaccine, that's one thing that I stray away from, only because I've seen people already getting sick from it, even nurses and doctors.
But when you say that you've seen them sick, is it the same as COVID, where you had
Yeah, I've seen one nurse, she got the vaccine, and she said that she was experiencing the shortness of breath, felt just really laggy, tired, and just lost the appetite. She started to feel depressed because she wasn't around her family. She was isolated. To see her go through that after getting the vaccine, and it's supposed to be something to help, I don't think I want to venture down that road.
What about her if she would have got COVID? Would it have been worse for her? Would she have?
I'm pretty sure it probably could have been a possibility, but to know that she was trying to protect herself from getting it and that was the outcome.
I'm on my Facebook and I see doctor died from COVID vaccine, or nurse died from COVID vaccine. I don't really read into it, just because it could be something else and it was a coincidence. A lot of it's just fake news.
The biggest challenge for getting communities of color to get vaccinated is really the barrier of hesitation. I grew up in North Minneapolis. I'm African American, so working on health equity and issues of, for example, vaccination are really important to me.
And I think especially as a Black person, I was raised to kind of question stuff.
As a Black person in America, you always have this low level, at least low level, maybe greater, of anxiety everywhere you go.
Black people have a hard time trusting doctors because of things that might have happened to them, their family member, or unfortunately the stuff in history, you think of the Tuskegee trials.
Hesitancy stems from what we all know as the Tuskegee study, where there were a group of men that had syphilis.
And so they followed these guys with syphilis to see, what was the course of the disease and how did it go. When the treatment for syphilis, namely penicillin, became accepted in the 1940s, they did not offer it to these people because they really wanted to follow the natural course of the disease. It gets worse because then this continued on until the 1970s, until somebody from the press published some huge story about it, and then the public was outraged. There was this systemic process of dehumanizing people of color, and particularly African Americans in this country, that has gone on for as long as we've been here.
When we have that as a major part of our history, it definitely will make us reluctant to think about, okay, so here's a new illness. Here's a new vaccine for that illness.
The delivery of health care in Native American culture is always best if you can be approached by someone you trust. It really makes a difference to have Native practitioners.
A few people, my dad and my boss included, they both got very, very sick after the first vaccine.
I got the Pfizer, and after my second shot, I just had a bit of a headache. And I feel like it's easy for me to talk with people where you have that connection, where you have that similar background. That they understand what you're talking about.
I think they get what I'm saying. And then there's that comfort that allows the person to ask questions. If you're talking to someone that looks like you, there's a general sense of, I think this person understands me.
So is there any truth to vaccine altering your DNA?
Hell, no.
So doctor,
Yes, sir.
where's all these viruses coming from, man? How are they being created, man?
So basically, coronaviruses have existed forever. Your common colds and all that, that's all coronaviruses. They're the same family of viruses.
Just like the flu.
It's been around for a long time too. But the flu be mutating all the time.
So, social aspect of the barbershop, this is a place where fathers bring their sons to talk about all sorts of topics. We touch on sports, we touch on politics, we talk about the issues of the day, just like the coronavirus. We have these conversations daily. Like I said, especially when coronavirus was new. And then the conversation about the vaccine started happening. We definitely go back to our history, and talk about what is it they're trying to do to us now? What are they gonna inject in us now?
And so, if you had it accessible everywhere and they knew they could walk down to their local church, their local barber shop, their local clinic and get a vaccine, that would help. And a lot of people would do it right away. But there'd probably still be a lot of people who wouldn't. And I think some of it would take some of the healthcare professionals who do work in the community to really keep having these discussions and making sure, that they're taking people's questions and concerns seriously, even if they're not based in facts or truth.
Cuando yo reaccioné, sí recuerdo que sí fue un asombro lo que viví. Cuando ya salí del hospital, yo estaba muy débil, el cuerpo no me respondía. Y al verme en esa situación, yo estaba cayendo en depresión. Yo no quería estar donde estaban mis hijos, mi esposa, buscaba la soledad. Llegó un momento donde yo me fui al baño y yo le grité y le hablé a Dios, ¿verdad? Que yo no me quería sentir así de esa forma. Yo de verdad estoy muy agradecido a cada doctor, enfermero, que estuvo ahí al tanto de mí, ¿verdad? En la historia que ella me contaba, me mencionaba, fíjate que cada vez que me llamaban del hospital, había un doctor que me hablaba.
Él era el que me daba la información, ¿verdad? De cómo estaba.
Y yo decía, ¿será que yo voy a tener la oportunidad de conocer a este doctor, verdad?
Yeah, I never spoke with Elder while he was in the hospital. Every time I saw him, he was on a ventilator.
Qué bueno verte y verte en persona y de pie. Creo que la última vez que nos vimos, tú todavía estabas intubado, cuando yo te vi en el hospital.
Ella es mi esposa.
Hola, ¿qué tal?
Carla.
Carla, mira, nos damos el... Encantado. ¿Cuántas veces hablamos por teléfono, verdad? A ver si se quita lo nublado y te puedo ver mejor la cara.
Hacemos algo que amamos, que es servirle a Dios, como pastores. En la iglesia es una iglesia que somos bien amorosos, fraternales, ¿verdad? Y antes nos saludábamos de mano y el abrazo, pero ahora, Dios le bendiga. He predicado acerca de que un Dios levanta, que da vida. En todo lo que he predicado acerca de milagros, de sanidades, en mí se ve uno de ellos. Entonces hoy yo puedo decir libremente de que si estoy vivo es porque Él así lo ha permitido.
Les bendiga, hermanos, en esta preciosa mañana hermosa. Amén. La palabra de Dios es algo maravilloso, es infalible, hermanos. Yo no sé si usted cuando era niño, hermano, tiene una marca aquí en el brazo. ¿Un hoyito la tiene? ¿Por qué es?
Una vacuna.
De la influenza hay una inyección. ¿Cuándo se ha puesto esa inyección? Paperas. De la rubiola. Del sarampión. ¿Sí han oído esas enfermedades? Y hay vacunas para ello. ¿Cuántos ya se vacunaron aquí contra el COVID? Levanten la mano los que ya se vacunaron del COVID. Va, tenemos 4 personas ya. Si a usted le llega la oportunidad de hacerlo, hágalo. Es importante, hermanos. Y si usted está pensando, no es que ese es el sello de la bestia, no es el sello de la bestia, hermano. Es la vacuna contra el virus que se llama COVID. Y si está a la disposición, hay que poner el hombro. ¿O le tiene miedo a las agujas?
So for the average person, vaccines are kind of a complicated science, no question about that. Ultimately, at the most basic level, the intent of vaccines is to give your immune system some familiarity with the infectious illness of interest, in this case, COVID-19, so that when your immune system comes across it again, it says, hey, I've seen that thing, let's kill it, let's go after it. And all these vaccines are really focused around this, what's called the spike protein on the COVID-19 virus.
The virus uses those spike proteins to get into the cell of yours that it wants to infect. When people worry about, I'm going to get COVID from this, no, these vaccines do nothing but produce spike protein. There's no COVID in there, but that's what they all do. And they do it in very different ways. The 2 mRNA vaccines, Pfizer and the Moderna, and they do it by sticking a messenger RNA into your cell.
Everybody's heard of DNA. That's sort of your cookbook for how do you make an organism that's in every cell of every living being on Earth. RNA is a step removed from that. It's essentially saying, let me take one recipe out of that cookbook because I want to make one thing. And so these vaccines work by taking that recipe and delivering it inside of another cell. Your own cells eat that up and then use your own cellular machinery to make something from that.
And they instruct that machinery to make spike protein, and that spike protein gets on the surface of your cell, and the immunity that it generates to that spike protein is the immunity that protects you.
Some of these whole virus vaccines, which are more similar to what we're familiar with in the past, essentially just do it by giving you an inactive form of the virus to attack, just not the protein alone. But at the end of the day, what I could tell the layperson is, If you wanted to know, well, gee, which vaccine should I get? I would say, get the one you can get soonest.
Nobody would have even dared to hope that we were going to have a vaccine as good as this one appears to be. It's miraculous. The amount of disease prevented is going to be huge.
In Latin America, we are educated to be vaccinated since the time we are born. So it is kind of natural for us. And we understand, because it's been our history, that the vaccines have been helping our communities to be more stable health-wise. But we are in the middle of some sort of unfortunate series of events that come together and confuse people.
Yes, it is different because it's a pandemic. It's was created in a year, and then all these people, adding a lot of myths and scare into our communities, and I think those are the major reasons why that they decide not to take the vaccine or kind of scared to even take it.
There is a lot of word of mouth that happens in the community. There's a lot of stories that folks have heard, or there's a lot of perhaps wrong associations.
It's a fascinating subject, what it is that actually convinces people to get vaccinated. Science guys like me talking about data basically don't convince a lot of people. So one science guy spouting data may convince another science guy, but mostly people come with their own conclusions and then go to these weird sources because they want reinforcement for the conclusion they have in their gut.
I think it's always a good thing to ask questions about medications and vaccines. There's nothing wrong with that. But if you are firmly against it no matter what, and you in fact believe that vaccines are terrible, I think that that's a group that's going to be really difficult to reach.
There is vaccine hesitancy or concerns which is circulating in the social media.
Given the way technology has become, people just cut and paste things, they create things and put out there to scare people.
Again, this is not just communities of color. They're concerned that vaccines have microchips and then the government's going to be tracking them.
Get microchipped with the vaccination.
Microchips?
Chips.
Bill Gates is somehow wanting to kill Africans by giving them the vaccine.
And then maybe that sounds crazy to you and I, but again, these are the fears that people have.
When you have that history, it doesn't sound silly to us. It doesn't feel silly to us. You know what I mean? It feels real. This may be really far-fetched, but I heard someone say that, they're injecting people with a strain of HIV.
They think that it's going to give them COVID.
It's COVID. You're giving me COVID.
They're testing it on us.
I heard that the vaccine is not that safe.
There are videos about a lady who got the vaccine and then fainted, and that turned out to be nothing related to the vaccine specifically.
Are we getting a diluted version?
They're using current aborted babies to make the vaccine.
The vaccine will infiltrate your DNA, and then you won't be able to have children and reduce your sperm.
So it will affect our fertility.
Is that true that alien substances are being used to develop the vaccine?
Messenger RNA is something that is going to be used to cause mutation.
That they will turn into a crocodile. They won't be a human anymore.
They've said if you take it, it's going to turn you into a zombie.
Don't become a zombie.
Oh, are you checking on me to make sure I've not become a zombie yet?
You got the vaccine, you never become a zombie. I was like, I would have been already a zombie.
All sorts of things that are, not true, but then again, they're being shared widely.
It's enough to make people that are reluctant remain reluctant and resistant to moving forward taking the vaccine.
Those are kind of the fears and the concerns that we have to combat, and that's the role of public health professionals and health professionals like myself to really speak to the science and really speak to the safety and really speak to the protections for what we have going on here in the United States that hopefully have people's best interests in mind.
So this year, it was a tough experience. It was a tough year. COVID happened. It shocked everybody. I honestly didn't think it was gonna affect us at all. You know, thinking I'm young, I'm healthy, I'm gonna be just fine. I didn't really care, you know, but I never really thought it was gonna affect my dad. So, this is it's a picture of me and my dad at my boot camp graduation from Fort Jackson. I believe he was very proud. He served as well. He know what it takes. He married my mom when he was 28. They met during the Korean Civil War. My dad, he was a medic in a resistance fight against the Burmese government. My mom often tells me that my dad saved a lot of lives during that time. My dad got really sick. Drove him to the ER. Sat with him for a while. He was wheezing. He couldn't breathe. Just the image of him like that just makes me feel so sad. And then the nurse came and tested him for COVID. And he came back positive. And then they took him up to the, ICU. And none of us could have gone up there to see him, you know. We were all hoping for a miracle. Everybody was crying. And then I guess they finally told us that dad was done. He was no longer here. He can't even say goodbye. It's just knowing how much I love my dad. I know it must have been incredibly unbearable for my mother. She couldn't stop crying for days, and this loss really brings a big hole in our family. Our dad was a root that, kept us together. So you see the space that he used to be in, and he's no longer there. We just keep maybe blaming ourselves that we couldn't be there, that we didn't do everything in our power to prevent him from getting this virus. That was the biggest regret I think all of us have. Me, personally, I think I would take the vaccine because I want to protect myself from getting it. And by protecting myself, I also protect my family. Seeing my family suffer, seeing my dad suffering, I would definitely encourage my mom to take it. I can't force her to take it. I can't force any of my other family to take it, but I believe that the experience that we went through, I think all of us all might just take it just so we can all be at a peace of mind.
Well, for me personally, I mean, look, I believe in science and I believe in public health, so I do not have any fears about the vaccine. But communities of color, again, with healthcare and healthcare research not taking their concerns seriously, I think there's hesitancy in healthcare professionals too. I'd like to think it's a lot less, but I'm sure it exists.
So, being a Black person myself, when it came to the COVID vaccine, like many other people, I can't speak for all Black people, I was quite skeptical. I'm like, how in the world did these people come up with something so fast? I don't understand.
I feel that I am a little bit, scared.
You listen to the hype, oh, it's coming so fast, and, why is this one, almost done, whereas for years, it took 3, 4, 5 years.
The long-lasting effects, we don't know. what they're gonna be, really. So that's just my thoughts, yeah.
Well, when I came to deciding if I wanted the vaccine or not, when I think about the COVID patients I see, regardless if you're young, old, healthy or not, you could be one of those patients in that bed. Realistically, you could.
So we all generally had concerns, but the scientists that developed the vaccines started to communicate just a little bit more, and that provides some confidence in terms of how the study is deployed, who's being studied in the research aspect of it, and the results.
What helped make me feel a little bit better is doing my own research outside of the media, outside of what crazy people were saying about the COVID and their personal thoughts, and getting down to the actual research. It came down to me basically feeling, at the end of the day, true, they came up with the vaccine and it seems like a short period of time to us, but in reality, they've been working on mRNA vaccines for a good while, longer than I've been alive, at least.
And, on this one, your left or right arm, and then other two, your straight.
So for me, being vaccinated, now I'm not concerned with going into a building where there are people that are underserved, that need the vaccine. I will still protect myself, but there's a peace of mind that I have knowing that I'm fully vaccinated.
I think it's just our minds. We still have in the back of our minds some sort of worries, but I feel confident in getting it, and this won't only help me, but help others.
And you haven't had any other shots in the last 2 weeks?
I think the more people that are vaccinated, then they can tell the story. And so that's what I've seen. So I've been very public. I posted my pictures, and I've encouraged my nurses that have received the vaccine to do the same thing, because we're trusted messengers. People know that we're going to tell you the truth. We have no reason to lie, because we don't want to harm our people. We want to help. And so we're hopeful that our conveying of what our experience is enough for people to say, okay, I know somebody that got it, and they're okay.
Ready? Oh. No worries. That's your airline. Take it out of here.
When it comes to vaccines, I think healthcare professionals have a wonderful opportunity to be role models.
And I think it helps when people see an image of a black doctor, a black nurse, a black healthcare professional getting the vaccine. They can say, gee, that person was brave enough to do it. Maybe I can do it too. Or if that person can be available to ask those questions.
I've been asked many times by patients, and I've been asked by family members, by neighbors, and by friends, did you get the vaccine? So I think people are looking for examples of who is getting the vaccine, who is not getting the vaccine.
Speaking about the vaccine, I'm eager to have it. For the good of the herd, we need to be vaccinated.
When I finally get fully vaccinated, I can now go out and help give the vaccine to other people. I can be out there more, knowing that I am fully protected.
I know that this is a very good way to deliver a message. I'm gonna tell my community that it is important, and that's why I'm doing it.